Hi guys! Sorry that this is not a live stream tonight, but we had a bit of a dodgy internet episode and thought it would be better to record this for you. So tonight I've got Lisa Ryan with me, who's a trauma-informed physiotherapist, and she specializes in chronic pain and helping people with pain to get the most out of their lives. So for those of you who don't know me, I'm Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. So have a look at the description of this video if you want a link to both Lisa's website as well as our own. So Lisa, welcome tonight. Thank you for joining us.
Thank you very much.
So listen, what on earth is a trauma-informed physiotherapist? What do you do?
Good question. A lot of people do ask me that question. So I'm trauma trained. So what I mean by that is I've had just some extra training in psychological trauma and how to sort of work and use that as a treatment method as well to help people. But trauma informed, it's essentially trauma informed care. So it's just about acknowledging the need to have a complete picture of a patient's life situation, and it helps you to recognize the signs and symptoms of trauma. So if someone's under quite a lot of stress, they might have poor resilience, they may not be that motivated to adhere to any programs, rehab programs or anything like that. It's just being able to identify those signs where you're basically trying to provide a safe space for someone. So what I mean by that is physically safe and psychologically safe as well, so that actual engagement in treatment is a little bit more successful, hopefully. And it just builds that trust where you actively avoid any sort of re-traumatization.
Okay.
So for example, if you're in clinic and someone might need some hands-on treatment, and if they've given you some details about possible past trauma, or even if they haven't, because not everybody's going to tell you that straight away. So it's just being mindful that yes, we can ask for consent and they can give us consent to be hands-on, but sometimes some people actually, just kind of deal with it at the time and have hands-on treatment, but actually inside them they are possibly being quite triggered or re-traumatized. And sometimes you might, if someone doesn't come back to clinic, or someone hasn't sort of made an appointment for a review or anything like that, just sometimes being aware that there could be possible other reasons which could be quite profound.
And is this trauma through a traumatic event that it's like a really bad injury that they had? Does it have to be, because when I think trauma, I think a car crash. Does it have to be something
Yeah.
like that?
Not necessarily. So it's about how you perceive that trauma. So for example, you could have two people that fall off their bike. One person could find that experience extremely traumatic because for whatever reason, and it takes a long time to kind of recover even after the physical injuries, there's no more physical injury, the actual incident could have been quite traumatic itself. And it's important to understand that it's not for us to, I guess, judge how terrible the trauma was. It's more about how people have perceived that incident for themselves. So you're going to have people ranging from having very complex childhood trauma, and that they've experienced incredibly hard things right from the beginning. Or you could have had someone who fell off their bike, and it was a big deal, and it was something that they found it quite difficult to recover from. So it varies, but it can come in all sorts of forms. What we tend to say is trauma is basically something that's happened to someone that has overwhelmed them.
Okay. So would that also mean that, because something that I often see with patients who's got injuries that take a long time to heal, and they can't do their sports that they used to do, and like for instance they're part of the running club and their identity is in the running club and that's what they do, and that can be really upsetting for them. Is that something that would fall in your domain as well?
Yeah, I mean, that can be huge for someone. That could be their whole connection. And like you said, their identity. So you take that away from someone because of an injury. To me, that's traumatic.
Hmm.
I know the word trauma can be quite kind of, we think about war zones and, quite extreme situations, but that can be traumatic itself because that person has lost their identity and it may have become overwhelming at the time because that's what they know, that's who their friends, where they meet up to connect with their friends. So yeah, that's a really good example.
And how does this tie in with chronic pain or ongoing pain?
So it's I mean, it's fascinating stuff. It's very complex, but I'll do my best to kind of condense it so it does make sense. But what I find is that if someone has had a traumatic event, and they weren't able to kind of come back to a more regulated state. So by that, what I mean is if they perceived a threat, or if they had, something quite difficult happen to them, the initial survival response is to go into a fight flight state. So it's that kind of nervous system activation that helps you to run or fight whatever situation you've needed to. The other side to that as well is the freeze response.
Mm.
So if the fight flight couldn't really be accessed for whatever reason, the freeze response can then come in. So if you're a child who couldn't necessarily maybe fight back or run away, you find that a lot of children will go into more of a freeze response. So it's when people get quite stuck in those survival responses. So if you find yourself in a chronic state of fight flight, so you're quite stressed and you're quite anxious, you've got high blood pressure, your anxiety anxiety levels, even if they're quite mild, it is that rapid heart rate and respiratory rate. So if you end up getting stuck in that kind of chronic dysregulated state, that's when you can start manifesting into physical symptoms, not just psychological symptoms. So that can manifest in pain. And the more I'm doing this work, the more I'm realizing that either response, so fight, flight, or even freeze, can manifest into physical pain because you can imagine if you're in protection mode, the whole point of pain, especially acute pain, is to protect you. And so you don't further damage anything. So if you're in a chronic state of protection mode because you're possibly stuck in this fight, flight, or freeze state, then it's nearly like your body is perceiving being under threat all the time, or at least quite consistently. So when, for example, if you're in a more regulated state, where you are able to handle possibly stressful situations a little bit easier, where you go into fight flight mode, but you actually then come out of it. That's where everything sort of works a little bit easier, and you're not necessarily at risk of disease or possible symptoms that could, yeah, impact on your life.
Okay. So you look to break that cycle so that even if somebody goes back into that, they've got the tools to then get themselves out of that again.
Yeah, and what's really important to point out is it's not about being constantly relaxed and doing
Yeah.
Zen
I was
mode.
just thinking, can I actually hire her and tell her that I'm because that would be brilliant.
Trust me, I mean, the world that we're in at the moment, it's a constant, it's stressful. We're not gonna
Yeah.
sugarcoat it and say, oh, we're all doing okay. It's a stressful situation. And any kind of uncertainty or any sense of, oh my gosh, this is terrifying or this
Mm.
is worrying, that's gonna put us in this state of fight flight.
I was just
Um,
I was just thinking of when you said freeze, that if you're that terrified, you can sometimes freeze. I used to freak my friends out at university because just before the exam would happen and we're all stressed the most, I would go to sleep and I would just
yeah,
sleep and they would all go, "What's going on with you?" And I think my body just went, "Yeah, we'll just have
yeah,
a nap."
yeah.
So,
Shut down mode.
yeah,
Yeah,
exactly. Okay, so tell
because
me, yeah, go for it.
I was just gonna say your body is so clever that instead of letting you get completely overwhelmed, it will put you in those states. So as
Yeah.
much as we feel like it could be a burden to feel these kind of, the nervous system activating or shutting down, the body's trying to help us as much as it can in a way.
Yeah.
So yeah, so
Oh.
it's about being able to, like you said, break the cycle where you're able to experience that activation because it's normal, it's natural, it's a natural survival response, but actually coming back down relatively quickly,
Mm,
and then yeah, being able to just get on with your day and
mm,
and yeah, stay connected with the present moment.
mm. So tell me, vagus nerve. I should know exactly what it is. I've got a vague idea what the vagus nerve is, and I think there's something with breathing to do with that. But explain to us what's going on there.
So the vagus nerve, it's the biggest nerve in the body,
Oh, great,
and
and I
it
don't know what it is.
so I mean, we didn't get taught about vagus nerve in uni, and I never came across it until I did trauma training. So yeah,
Oh, good.
it's not that no, it's not that known, despite its many functions. So it's part of the autonomic nervous system. So the part of the system that basically just controls everything unconsciously. So our breathing, our heart, digestive systems, all these different systems that continue on in the background that we're not necessarily that aware of. The vagus nerve, it basically is part of controlling those functions. So when we go into this fight flight mode, the vagus nerves allows or basically just triggers the heart to beat faster, respiratory rate to increase. So anything that we need to get us out of that situation, the vagus nerve is basically on it.
Okay.
Um, yeah, but what it does as well is it shuts down our digestive system, because when we're trying to escape from something, we don't need our digestive system. So again, it's very, very clever, but maybe not as useful for us in this day and age.
Mm,
And then the other side to it as well is that it basically relaxes us. So it brings us back down to that rest and digest state. It switches the digestive system back on. So it basically controls really important systems and, yeah, all the organs and everything that would contribute to the systems working pretty good. So when the vagus nerve isn't really, it's a difficult one because language here is quite important, because it's not that the vagus nerve is damaged. Like it could be if you've had some, actual trauma to it, physical trauma, but what the literature is describing it more as is vagal tone. So
Sorry,
just as
just
you
say that again, because the internet cut out just as you said that. Sorry.
so the literature, they explain it more like vagal tone. So just like muscle tone, if it's low, then it's not as strong, and it doesn't help you with your balance and strength and all the rest of it. So they talk more about the vagal tone. So if our vagal tone has for some reason reduced to quite a lower level, where it's quite dysregulated, that's when we can have those symptoms of fatigue and depression, poor sleep, poor digestion. Basically, system-wide, things aren't quite working as smoothly as they should. And then the opposite side to that is when it's hyperactive and it's very active to the point where the body is in this constant state of stress. Then it's about being able to basically re-regulate in a way the vagus nerve and have it so it's in a healthy position to be able to control all the different systems as it should.
And what causes it to go off piste? What makes it go overactive or underactive?
So trauma is the big one, because especially childhood trauma, where we've possibly had to be in a freeze state a lot of the time. So again, if we've not necessarily had or been in a position where we could defend ourselves in any way, and children have had to sort of develop other ways of dealing with the situation, then there is that risk of going into more of a freeze state, sort of the shutdown state. There's a fourth F, which the psychological literature talks more about, the fawn response. So it's like trying to please a lot. So people pleasing, and as a child, you're trying to kind of navigate your way through quite a toxic situation. You may be suppressing or dampening down a lot of your kind of life energy to be able to manage a really, really tricky situation. So the childhood trauma can be a huge risk factor, and that's why there's a lot of evidence to show that the more you've experienced in childhood, the more you are at risk of developing a lot of chronic illnesses and chronic pain as well. So
okay. And so tell me, how can you regulate the vagus nerve then, and how does it tie in with your work that that? What can you do about it?
So if someone comes into me, let's say, for example, chronic back pain, and they're in this sort of chronic, even mild state of stress, sort of activated nervous system, you can basically help them to stimulate the vagus nerve so that it becomes more regulated. So someone with chronic back pain, they may come to you and they may not even appreciate or acknowledge that they're in that state of fight flight. They might just think it's completely normal, because they may have had it since a very young age. So it's being able to have those conversations and identifying and getting the need to get sort of the complete picture of someone's life situation, so that we can basically play detective and see, you know, what may have contributed to you being stuck in this fight, flight, or freeze response. Um, and with that, you basically try and support someone to feel connected and feel safe. So when I say safe, it's feeling internally safe and externally safe, and it's more about, you know, there may not be any threats anywhere, but if that person feels threatened and doesn't feel safe, it's about allowing people to explore ways of just basically feeling quite safe within themselves again. And that's why I came up with the title, From Protection to Connection, because you're going from a protective state, because, you know, in protection mode, you're hyper aware, you're studying the room, you're making sure that, you know where the closest exit is. So you're in this kind of tensed up way, because even posture can, you know, have
So
your
I
body.
guess some ways that you can identify that in yourself. I'm just thinking of people coming to mind would be something like that you go somewhere or you decide not to go somewhere because you're too worried that you're going to be in a situation and you've got to stand because your back is bad and you're going to feel too bad not to be able to stand. So you're in the end avoiding things like that and situations like that. And another thing that comes to mind is people who struggle to sit because they've got pain with sitting. So they end up avoiding social interactions that could be okay, but it's that fear of what if I can't get out of there that they then don't attempt. So I guess that would fall in that category.
Definitely, and they're real fears. You know, you'll know yourself and speaking to people. They're real fears where it just doesn't feel quite safe. And it's having that worry and having, you know, a list of things of, you know, will this be okay? Will that be okay? And even going to a physio appointment and, you know, is my lift going to be there on time? Will the bus stop be close enough? Like all these things that can contribute into, you know, people just not feeling safe in the world and
And that
within
I
themselves.
guess that this ironically the physio appointment becomes a stressful thing in itself because they may be worried about being on time, they may be worried about what's this physio going to do to them. I can tell you that I've had quite a few people as new patients initial appointments where they're quite relieved at the end and they actually go, oh good, I was so worried about what you're going to do today. And it's like, you need to tell me what if something's not comfortable. But yeah, then only
Yeah,
then do you realize that they were actually frightened, probably for the first
yeah,
half of the session until they realized that I'm not going to do anything weird to them. Um,
yeah,
but yeah.
absolutely. And the beauty of virtual appointments, I don't know if you found it yourself, is that, you know, they can be in their own home and they start off hopefully, you know, in a good place where they feel quite comfortable. They've got their own pillows and blankets, or, you know, I'm sure our our clinics are probably a little bit different, but yeah, like the relaxation class I have, yeah, everyone just gets pretty
Yeah,
cozy. There's no.
so tell us about what techniques do you use? How do you is there anything that people can do themselves to help get this nerve under control?
Yeah, so there's a few things you can do to help stimulate the vagus nerve. So my favorite one is singing. Singing and laughter is they're two amazing things that can yeah, just increase that tone, because there's vibration, there's hormonal changes as well when we smile, laugh, sing. And it sounds so simple, and sometimes those things that sound so simple are nearly a bit too good to be
So
true.
what do you mean with singing? Because I'm sitting here thinking, oh my word, I never even sang in church because I was too false to sing. So is that singing to a song? Is that singing Whitney Houston? What type of singing are we talking here?
Well, if you ask me, it's Celine Dion, but it's definitely not, you wouldn't need to sit in clinic and start singing. It's literally it's what you enjoy, it's what brings you joy. So if you say to me, oh, I really enjoy belting out a Whitney Houston in the shower, then that's exactly what I'd prescribe. I'd say go for it, enjoy it, find the joy that moment for yourself.
And is this something that you would tell them to do when they feel stressed or overwhelmed, or is it something that you get people to do as kind of like we do exercise every day? Is it something that you just get them to do every day rather than just wait until you're stressed and then go sing?
Yeah, definitely. My favorite technique, again, super simple, is grounding and orientating. So you start off with grounding. So just literally feeling the support of the ground underneath your feet. It's a lot easier just to have bare feet if it's.
Oh, I think our internet just cut out.
Oh,
Hello? There we go. Okay,
hello.
so I lost you at it's a lot easier if you just have bare feet.
Yes. So just so you can kind of really sense the ground, flooring, the earth, the mud underneath your feet. So anything that you can feel underneath your feet. And it's about feeling a sense of grounding. So when we practice grounding, we automatically feel a lot more centered because it brings us back to the here and now. So if you're in a state of anxiety or high stress, you're forcing yourself to connect to the body and just feeling the feet on the ground. And then you just connect a little bit with your breath. So you don't have to change your breath. You don't have to do anything to it. You just connect to it. You just become mindful of your breath going in and out. And then you finish off with orientating. So I really like this one because if we think about our reptilian brain, so that brain that was first evolved and is part of our sort of survival mechanism, if we gain feedback through our eyes and into the brain and visually see that where we are is quite safe, we can connect to the brain and we can basically say to the brain, even though I feel under threat for whatever reason, I can just very slowly and softly look around the room that I'm in, take note of things, objects, and you're orientating to, again, to the here and now. That can be super useful. Obviously, it gets tricky when you may not be in a situation where it feels safe. So that's more a good technique when you just feel really quite anxious and stressed. And if you're at home or wherever, really, you can, just start to ground and orientate. And where things could have got overwhelming, you just come back down to a more regulated state. And one other little technique I really like, is putting pressure on the top lip. So you're literally just pressing on the top lip and you're stimulating the nerves that help to self-soothe. So if you think as babies, if we were breastfeeding, bottle feeding, however we were fed, we would have had quite a nice bit of pressure around this area that would have helped us soothe. Not only are we feeding, but we're also having time to soothe as well. So you'll find people automatically, if they're shocked or something's been quite intense for them, they'll go, oh wow, gosh. And there's this amazing picture of everybody standing like this, looking at the 9/11 towers, in that kind of automatic soothing. So that's a really nice one. And you can do that absolutely anyway. You just kind of tap away or just
Just don't let the other person know that you're having to calm yourself down or you're going to kill them.
Yeah, exactly. That argument you had last night, just yeah.
Yeah, exactly. So you mentioned relaxation classes and things. How do you work? And you do all of this stuff online. How does it work?
Yeah, I've been really lucky. I've been doing this online for about 4.5 years. Sort of half and half with face to face, and then obviously with COVID, it just went completely online. So it's actually do your basics of
I'm so
setting.
sorry, but you cut out after with COVID. It all went online.
Okay, yeah. So COVID shoved me online full time, and yeah, the sessions they're more like coaching sessions. So I'm more of a pain coach, I guess. And then I would use different modalities to help with any kind of trauma that someone might be experiencing, and that all can be done online quite nicely. And then the classes, I've got weekly relaxation classes where you get to learn all these wonderful techniques that helps the vagus nerve. Imaginations are really sort of imagery work is a really nice technique as well. So that's weekly, and then I've ran and I'm due to run one again. It's the emotional freedom technique course that I do. So I don't know if anyone's heard of tapping.
I
So
have actually, and I have no idea what it is. It just sounds really weird.
yeah. Well, if kind of we've got our heads around acupuncture, so it's basically like pressure points, and it's amazing because it stimulates part of the brain that will help you to relax.
Yeah, because is that not something that I may have the wrong end of the stick here, but that a lot of psychology type people use these days, that it's because I think I actually heard from it the first time of it when my aunt spoke about it, who's a psychologist or somebody who does that.
Yeah, it's a nice, it bridges a gap between talking therapy and I guess the sort of physical therapy, because you're combining both, and it's quite nice to kind of feel into any sort of difficult emotion that you might be feeling, but it doesn't become overwhelming because the tapping that you're doing helps you to stay calm and relaxed. So you'll find so many people who experience ongoing pain that there's a lot of frustration, there's a lot of anger, a lot of really difficult emotions that could just be very, very overwhelming. So it's acknowledging that those emotions are there, because we don't want to brush them to one side. We want to feel them and process them. But the actual tapping allows us to stay in a nice kind of regulated state and being able to process it a little bit easier.
So just one of the big things always is, how does somebody know that you can be useful to them? What's your examples of people who you've helped, or situations that you think can be useful?
Yeah, I've got a couple of examples. So I had a gentleman quite recently where he came to me with a frozen shoulder. So he had a lot of sort of physiotherapy, osteopathy, had quite a bit of acupuncture as well. Nothing was really working. So he came to me, I think he'd had it for a few years, and just, this please help, my shoulder's not great at all. And then with that, of course, there's loss of function and strength and all the rest of it. So we kind of delved into his story in a way. Not that you have to unearth everything, but it transpired that he was actually bullied quite a bit in school. And with that, he did develop a sense of not feeling safe because he was bullied and there was quite a lot of physical abuse there as well. So his posture, everything was kind of held, constricted, and even his breathing was quite shallow because he'd, got into that kind of posture over the years and how it adapted. So despite him, leaving school and going to uni, having some really good experiences at uni, meeting his wife and all the rest of it, his later years were fine, and he didn't think much of it. But we ended up addressing the trauma that he experienced at school, and it was amazing because his neck, his shoulders, like everything just kind of relaxed, and it was internally he started to feel actual safety rather than, oh, it's fine, everything's fine, I've moved on from what happened. And yeah, I mean, he certainly needed some help with his strength, but general range of movement was just amazing because things just Because one thing about the vagus nerve, the cranial nerves as well, because they innervate the neck, the shoulders, when they get switched on and when they're kind of better stimulated, they function better as well. So strength, range of movement, that can certainly be helped by, these nerves being a bit more switched on.
I think something that I didn't appreciate enough, well, first of all, before I studied physiotherapy, I thought nerves were tiny little electrical currents, and I never realized that they're robust, strong things that you can actually, that's quite thick. And the other thing that I only realized probably after I finished studying, to be honest, years later, that nerves are in charge of so much more. The obvious thing that we think about is the muscles they control, the pain that they create. But we forget that actually our immune system, our breathing, every single process, there's not something that happens inside of a cell that happens without a nerve causing it to happen. And it all gets affected. And I would love to see where we're going to be in 20 years from now with regards to understanding these things, because all of the stuff that you're talking about now has only really come about in the last few years that people have truly started accepting it. And I think it's also people have recognized these things, but they've given them weird explanations or weird terms in the past. And Western medicine has gone, no, this is absolute nonsense. What do you mean with energy and things? But actually, the more that people see how well it works, the better they investigate and the more they get proper clinical answers for why things happen. Lisa, anything else before we wrap it up that you feel would be useful to share tonight?
The inflammation side of the vagus nerve, slightly important.
That's the one that I was interested in. I can't believe I forgot about it.
Just from an inflammatory point of view, so when the vagus nerve, if it's dysregulated, because its function is in immunity as well, that it can actually cause kind of systemic inflammation.
Okay.
So I've had a couple of clients where working with a vagus nerve has actually hugely reduced their inflammation levels, so systemic inflammation levels, the pain either has reduced dramatically or disappeared, to do with the immunity, the immune system working with the vagus nerve to help with that has been really good. And things like irritable bowel syndrome, when we switch or help to stimulate the vagus nerve, it helps the digestive system to sort of come back online as well. So
yeah, that was quite revelation or a revelation for me when I first heard, and it immediately made sense when I heard it about, how fight or flight, we're meant to be running so blood goes away from your gut. And we studied this at university, that bit we all knew. But then the penny didn't quite drop that, listen, if you're in constant flight or fight, your gut's just being starved, because now it's the muscles can react at any time, but the gut's not getting anything. And it's like, okay, that makes so much sense how irritable bowel will tie in with chronic stress then. So yeah.
Because there's, people ask me all the time, should I be eating more omega-3? And they're all valid questions. And obviously I'm not really there to answer those kind of questions. But I also advise, we could have the best diet in the world, but if our digestive system is in sort of shutdown mode, then we're not going to be getting the nutrients that we need. And even the blood flow, if it's constricted and going basically,
I've got a question for you. So
pardon?
I've got a question for you.
Yeah.
I've had quite a few patients where I know that their stress levels is part of the thing, and where I know if they can just shut it down and do some mindfulness or something like that. What do you do with people where mindfulness is not their thing? So, the typical person who goes, if you tell me to empty my mind, I think of all the list of tomorrow and the day after, and I just don't do this. I can't stand it. It drives me nuts when people talk in those voices, and I can't do that.
Great question. I love this question, because what we need to remember is, yes, some people just will not like mindfulness, and that's okay, because it's not going to be for everyone. But what people tend to find, and the irritation can come from the fact that connecting to the body is just too much. It's way too much. So things like meditation and mindfulness, it's not going to work for everyone, or at least it's going to be quite difficult for a lot of people, because you're asking someone who may have, a history of trauma or a history of having to disconnect from the body, because being too connected, it increases their pain. It's just this constant pain. Therefore, from a survival point of view, the body finds it better to dissociate from the body. So asking someone then to, connect to it and feel this and feel that and feel it can be incredibly frustrating. And sometimes that frustration actually is masking deeper things that are probably going on. Obviously not for everyone, but when people say, I just can't do meditation or mindfulness, and you dig a little bit deeper, and a lot of it's to do with it's too overwhelming, but that can be on an unconscious level. So consciously we recognize that as, it's boring, it's annoying, I can't do it. Where unconsciously it's more of this, it's too much going on.
Okay. Yeah.
That makes sense.
Absolutely. So tell me, Lisa, how can people get in touch with you? I've got your email or your website up on the screen at the moment, lisaryanphysiotherapy.com. What's your email address, or are you on Twitter? Where can they find you?
So I'm on Instagram and Facebook. So Instagram, it's at Lisa Ryan Physio, and then Facebook at Lisa Ryan Physio Online. And then my email address is hello@lisaryanphysiotherapy.com.
Brilliant. Excellent. So guys, if you're watching this in the events page tonight and wondering what's going on, why it's not live, then sorry about it. It was our internet, and you're welcome to ask questions in the comments here. But also, if you've got questions for Lisa direct, you can either tag her or you can just email her and just ask.